Hello, welcome to SCAN. My name is Pat Bohse. I'm the Executive Director of SCAN. And this is a new day, a new year, and a new opportunity. And I'm just so happy to be able to have as my guest Freeholder Susan M. Kiley, who a year ago we met, the same place, same time, same station. And we were talking about a variety of things. But let me just tell you a little bit about Freeholder Kiley. In her other life, she was a registered nurse for about 30 years and worked in the healthcare industry. So all of that knowledge, I'm sure, is coming in very handy now with the pandemic and all of the stuff that we're going through. She served in Hazlitt. She lives in Hazlitt and served on the town committee since 2014. She graduated from committee woman to deputy mayor to mayor. Very nice process. And then in 2019, she became freeholder. And I have to tell you, I've had the pleasure of working with her for the last 2 years and very encouraged that we're in good hands. She is the deputy director and she oversees human services and all of the divisions that come under it. She's also on the executive committee of 2 not-for-profits. So I think she gets the full picture in regards to what we're all going through. But most important, she's married to a fabulous guy, has 5 children and 11 grandchildren and 12. Great. Oh,
number 12
on the way. I'm sorry.
Yes, he is.
And 1 is on the way. So again, welcome, Freeholder Kiley. It's really great to have you with us.
Thank you so much, Pat. I appreciate that. It's great to be here. I love the SCAN organization.
I appreciate that. We're gonna, what I really want to do today is kind of bring the audience up to speed on what's going on with Monmouth Acts and then the special initiative that has been introduced into the community in the last couple of months. So it's all yours.
Okay, great. Well, the timing was perfect because when I started as a freeholder and took over responsibility for health and human services, we had just completed an assessment of the human needs inside of our county to really understand what the needs were and whether or not we were dedicating resources the right way and delivering services the best way we could. And from that came an organization called Monmouth Acts. HCTS stands for Assisting Communities Through Service. And it's an innovative private-public partnership between the Monmouth County government entities and all of the human service shareholders in the community that are delivering services to our residents. SCAN is a member, as you know. And we have some tremendous membership. It's the first time anything like this has ever been created. And it really gives us an opportunity to use the phrase no wrong door. So if you think about any place you go for services, they are now part of one big network, and that network can satisfy all of your needs, knows what's out there, and can direct you to the help you need. So the hubs that are inside of Monmouth Acts, the focus areas, are early childhood success, working with moms and babies and early development, positive youth development, aging, homelessness, transportation, financial empowerment, mental health and addiction services, and then most important, communication. Because what we have found is that no matter how much we think we're communicating, we could always do it better. And there are always people out there that don't realize the services that are available. So that's a big focus.
Yeah.
So I mentioned financial empowerment. Do you want me to keep going?
Sure, I do. I mean, I think the whole financial empowerment really leads into the whole recovery initiative.
Exactly right. So the Financial Empowerment Hub was originally working on things we partner with United Way. They have their financial centers, partner with SCAN. We help anyone that might need help with their finances, whether that's a senior citizen trying to figure out what their benefits are, how to manage the healthcare, Medicare, Medicaid system, anything like that was part of the Financial Hub. Enter COVID-19. And all of a sudden, our unemployment rates are higher than they have ever been. ever, as far back as I can remember. People that would normally have a job and maybe a very high paying job, all of a sudden have been furloughed or have been let go because, businesses are shutting down. So there are people in our county that have never experienced the level of distress, I guess, that they're experiencing now. And we wanted to do something more targeted to help those people suffering because of COVID-19. So out of the financial hub came a much more specific organization called the Financial Recovery Initiative.
And so exactly what does it do, the recovery initiative?
Sure. The Financial Recovery Initiative is going to build on what Monmouth Acts has already done and pull public and community organizations together. We've created a clearinghouse where anyone can go for access to information that they're going to need to be able to get through, the situation we're in right now. The Financial Recovery Clearinghouse has organizations like the Division of Social Services, United Way, Fulfill. We have a lot of food insecurity out there, people that are really struggling with making sure they have food on their tables. We have a Child Care Connection, lots of child care organizations. Here's the other thing that's happening that we've never experienced before, right? You may have to work from home, but now you've got two jobs because you have to be the teacher of your children who are now being taught from home. So, wow, how do we do this? A lot of the child care organizations don't want to open because of safety reasons. So now these kids have to be watched by someone, and we're trying to help people through that situation. We have also the Workforce Development Group that is part of the Financial Recovery Initiative. So you can get in touch with them, and there's grant money available for training into a new position or training into a new job. They have a job bank of positions that are available, and we can help you to either find employment in your current field or to search for employment in another field. We have all the municipalities involved. We have faith-based organizations involved. Family Success Centers, Brookdale Community College is involved in the initiative. And the goal, as I said, is to find a way to be able to assist our residents, no matter what their issues may be, as it relates to their finances, the COVID crisis and childcare, et cetera.
I'm thinking about all of those services, and what I'm really impressed with and excited about is that we're finally talking to each other. I mean, I think we've all been little islands unto ourselves,
Sure.
and so now we're able, under, being part of this group or this subgroup, that we meet regularly, and we have conversations, and we are updated on what kind of calls came in. We'll talk about a little bit later about warm calls and cold calls and how that all works. But do you have a phone number or a website that people can go to get more information?
I have both, actually.
Okay.
So let me give you the phone number first. I'll pull that out. There's two ways to access the system. Well, there's more than two ways to access. We'll talk about that in a minute. But we put together a website. So if you go to the Monmouth Acts website, financial recovery is going to pop up, and the website will kind of direct you to that. I tell people to go to www.visitmonmouth.com, because that's the Monmouth County web or homepage. Okay. And listed on the right-hand side of that is COVID information, Monmouth Acts, a lot of information that you should get used to going there first to find the information you need. And then once you're there, you can click on the Monmouth Acts button. That will take you right to the Monmouth Acts website, and it will take you to the Financial Recovery Initiative. Now, I don't know how savvy I really am with computers, but I think I know how to work them pretty well. But there are a lot of people out there that don't. So what we did was we created a warm line, which is manned, so that you can call in and actually speak to a person. Everything said on those calls is confidential. We gather information on the calls that's helpful for us to understand where we need to focus our resources. So we'll record the age of the caller, whether it's male, female, whether it's it's someone requesting help with food service, or whatever those issues are, we record those. As I said, everything's kept very confidential. It's only for us to be able to provide a better service. And do you want me to give you that number?
Yes, ma'am.
That number is 732-683-8959. And as I said, a trained customer service, social service person will answer the phone. If they are not there and you go to a voicemail system, they will return your call, and you'll be able to get the help you need.
Yeah, and I'm really happy that we have two alternatives, electronic plus telephone. I mean, one of the lessons we've learned during this whole COVID situation, I mean, we've been virtual probably since March 17th when the malls were closed down by the governor, is that there really is a digital divide going on, not just here in Monmouth County, all over. So many seniors don't have access to technology. I mean, either they have it and don't know how to use it, or they can't afford it. And that's another conversation. But so this way, if they don't have it, or they don't have a smartphone or any of that, they can actually call people. And that's really wonderful. So I'm happy that we were able to provide both resources so that someone can get help who needs it, and whatever technology they have or they don't have. So I do thank you for that.
Sure. No, we're happy to do it. There's a huge need out there, and we've put together the financial task force. I'll talk a little bit about the leadership group that oversees it. We've put together this clearinghouse of organizations that have said, we're here, we're ready. Now we just need someone to call and ask for the help. And sometimes that's the hardest part, especially when you're not used to doing it.
No, absolutely. And like you said before, so many people who never, ever were in this situation or never had to ask for help and, were self-reliant is now in a situation that's so unfamiliar to them. And so this hopefully will be a wonderful opportunity. We're going to take a break for a commercial break. And so we'll be back in a minute. Thank you.
Take it from me. Living with diabetes is no easy task, but I learned how to manage my health condition, and so can you. The Diabetes Self-Management Program is a 6-week self-management workshop created by Stanford University. The program provides you with proven strategies to manage your diabetes and reclaim your life. You will join an interactive and mutually supportive workshop whose success builds confidence to effectively manage your diabetes and allows you to maintain an active lifestyle. See how proper nutrition, exercise, and medication management help you increase your energy, manage side effects, and keep you feeling in control. You will not only receive a copy of this book, but you will get guidance and support from others like you living with diabetes.
The Diabetes Self-Management Workshop meets once a week for 6 weeks. This innovative workshop is offered to all Monmouth County residents. Call the number on your screen to register or get additional information at scannj.org.
Welcome back to Welcome to SCAN. I'm Pat Bohse, the Executive Director of SCAN, and our guest today is Freeholder Susan M. Kiley. I'm just so happy that you're with us because the information you're providing us is just so helpful and so timely. And so can you tell us a little more about the who in regards to started the group or the organizations that are involved and how they were selected? And
Sure, absolutely. Well, we needed great people. That's why you're on the board.
Thank you.
No, but seriously, what we did was we identified the need, right? And we recognize that there are a lot of people, as we've said already, that have never sought help before through a social services organization or any organization for that matter. So we wanted to have task force members that were well established in a diverse backgrounds, and make sure that when people saw those names, they might feel that this is a little bit more approachable. Okay, So for example, I'm the chair of the organization. Frank Robinson, who is a businessman that's been involved in New Jersey for many, many years, he's one of the co-chairs. And Pastor Johnson from the St. Stephen's Church in Asbury Park is the other co-chair. But then we also have organizations that are represented, like the Preferred Behavioral Health Organization. We have a gentleman who's the president of the Central Regional Ocean First Bank, who obviously brings a lot to the table in terms of understanding money that might be available to residents who need help. The president of the United Way is on the group. You're on the group. We have Larry Sternbach, who is the director of the Workforce Development. Again, you know, looking at it from a different angle. How can I help these people find jobs or get training if they need it? And then we have private citizens that are also on the board that bring, I guess, fresh eyes. You know, they're not part of the group that works together. They're on the outside looking in. And we've gotten some of the greatest benefit from them because, you know, we'll make an expression and they'll say, wait a minute, well, I don't know what that means. You know, what does that mean? Or they'll say, that doesn't ring true to me. How do I help me feel more comfortable about that? So they come at it from a different angle and they really contribute a lot to the initiative. And the goal, David Stout, the president of Brookdale, he's on the group. The goal for this group is for them to challenge the program, you know, challenge who's in it, challenge the work group and say, no, we need to do more of this. We need to do less of that, so that we just make this a better and better initiative for the residents that need it.
Yeah, I'm really pleased that we're talking to people who we're really trying to serve versus telling them what we think that's best for them, because they're the customer. You know, we need to go to the customer versus them coming to us. And if we can make some of those minor changes, I don't think that it's a whole lot of issues other than the, you know, the alphabet soup that we talk. I mean, no one knows what our letters mean. So, I mean, common, good, simple language is really just so important. So I'm happy that there are consumers and residents on the committee.
Right.
So again, can you talk a little bit about the warm calls?
Sure.
And versus, you know, the internet?
Yes, absolutely. So that was another thing that came out of, you know, one of the conversations with the leadership group, the task force, because one of the gentlemen, while we were on the call, was trying to access the website and he couldn't get to it. And he said, okay, this might be easy for you, but I'm struggling. So help me with this. And that led to a discussion about, we need a line people can call and talk to a real person, right? Not a record. I mean, the only recording you would get is if you happen to call after hours and you get the answering machine, but you will get a call back. And these people come from a social service background and have received additional training in customer service, so that they are, you know, very approachable on the line and able to, and they've been educated on everything that's in the network, so they can direct people to the right places. The warm line, I'll give you the number again. It's 732-683-8959. And I'll tell you, our call volume is increasing, which is good news. And the areas where we're getting the greatest number of calls is on food insecurity. How do I get food? And we're directing a lot of those calls to Fulfill and other organizations. We get a lot of calls about SNAP. SNAP stands for the food stamp program, so that people that right now need it can access it. You know, we all support those programs when we don't need them. If we do need them, we should take advantage.
Yeah, the seniors have been getting notices that they're getting additional money in their SNAP allocation, and they're jumping up and down.
Yeah, that's great.
Because they really need it. I mean, and also it's part of the benefit packages that we try to get for a lot of the members in the community.
Homelessness is a big issue, or you know, people that are worried about paying their rents and their mortgages. We get a lot of calls on that. So those, I think, are the three biggest areas: homelessness, the SNAP, and food insecurity in general.
Yeah, really.
Workforce development's been a little busy too.
Yeah, I heard a presentation by Larry recently, and I didn't know that they had dollars available for present employees to take additional classes to better their skills for either on the job or for future jobs. So we're taking advantage of that one.
Good, that's good. I just want to add one thing. A lot of people ask me, is this all free? Your phone calls are free, your counseling is free, any advice that you get from these organizations is free. If they direct you to a service that has a charge, they'll tell you that. You know, like for example, Larry's group and the workforce development is going to provide a lot of services at no charge, and they do have grant money. If they refer you to something that's going to cost you money, they'll talk about that first. But for the most part, you know, the call is free and the advice is free.
Yeah, and again, we're really encouraging people to take advantage of it.
Yeah.
So I think that the other piece I really like to talk through, we have about 5 minutes left, is COVID-19 and the vaccination program here in Monmouth County.
Sure, sure. So I'll tell you what's happened. Well, first of all, we've been in preparation for the vaccine for many, many months and have had weekly calls with the state, with federal organizations, with the hospital systems, talking about what it's going to take to prepare for this. One of the things that Monmouth County did was submit an application and all the paperwork necessary to be a provider of the vaccines. So the Monmouth County Health Department will eventually be able to administer the vaccines. With that comes a tremendous need for equipment. You know, this vaccine has to be kept at minus 95 degrees. I mean, there are not refrigerated storage units that exist today that go that low. So there's a lot of money involved in getting ready for the vaccine, and we've made that investment. Today, vaccines have been shipped and delivered to the hospitals. I actually learned today that Bayshore is administering, so is Central State, I believe. I think all the hospitals are administering to first responders. And then I'm getting an update this afternoon, so the timing is ironic, but the next wave will be to senior citizens that are in long-term care facilities. There are some organizations gearing up to do that. Moderna, as you know, has been approved and is being shipped out to across the country to be able to have a second vaccine option. And I don't believe Moderna requires that deep frozen refrigeration. So it'll be a little bit easier to manage, I believe.
Yes, I think so too.
Yeah, and then, you know, the county and everybody that's permitted to administer the vaccines will be administering next. We've already contracted with a nursing group so that we're ready to go. You know, if they showed up tomorrow, we'd be able to start administering immediately. But the hospitals are doing that now.
Yeah, and I'm sure that when it gets a little more finalized, there'll be information on the website, on the county website, as far as where to go and when and how do you make an appointment or whatever you need to do. So
Okay.
I'm really excited about that. Can you just give us the county website one more time?
Yes, it's www.visitmonmouth.com.
Okay. And
And
from
as
there,
I said, everything's going to be there. You can, that's kind of the entrance in, and then you can go anywhere you want from there.
yeah. And so I'm hoping that people will take advantage of that and call. But I do know that some people are a little concerned about taking the shot, but we really need to encourage them that we need this. I guess they're calling it the herd mentality, as far as all of us getting vaccinated so that we can control this pandemic. So I'm encouraging people to do that too. I know some of the seniors, we did a survey of the members and we asked them if they wanted to come back for the winter semester, and they said, absolutely not. They said they love their online classes. So we were happy that we were able to go virtual, and we'll always have a dual platform in the future. We found that there's so many people who are homebound, whether by choice or physically. And so why not provide the service to them directly? So we're excited about that too. But I'm looking forward to the new year and a lot of new activities. And I personally want to thank you for all of the stuff that you do for the county. I'm very pleased to work with you and with the county fathers, so to speak. And I do think that we'll have a good year together collectively. So again, I want to thank you. I'm speaking to Freeholder Susan Kiley, and there's a lot more to come. So stay tuned and make sure that if you have needs that you touch base with either the WARM line or the online portal for the Financial Recovery Institute. So I want to thank you and hope that you all stay safe and well. Thank you, Sue.
Thank you, Pat. I appreciate being here.